This video of mine is about celiac disease, which is also sometimes called celiac, sprue, or gluten-sensitive enteropathy. Earlier I posted a short video in which I presented an overview about this illness. I hope you have already seen that video, and today I am going to discuss this disease in detail. Okay, celiac disease is an immune reaction to eating gluten, which is a protein found in wheat, barley, and rye. If you have celiac disease, eating gluten triggers an immune response in your small intestine. Over time, this reaction damages your small intestine lining and prevents it from absorbing some important nutrients, and that causes malabsorption. The intestinal damage often causes diarrhea, fatigue, weight loss, bloating, and anemia, and can lead to serious complications. In children, malabsorption can affect growth and development besides causing the symptoms seen in adults. There is no cure for celiac disease, but for most people, following a strict gluten-free diet can help manage symptoms and promote intestinal healing. Now let me tell you the symptoms of celiac disease first in adults. The signs and symptoms of celiac disease can vary greatly and differ in children and adults. Digestive signs and symptoms for adults include diarrhea, fatigue, weight loss, bloating and gas, abdominal pain, nausea and vomiting. Also, you may suffer from constipation. However, more than half the adults with celiac disease have signs and symptoms unrelated to the digestive system that include anemia, usually from iron deficiency, loss of bone density, which is also known as osteoporosis, or softening of bone, which is known as osteomalacia. There could be itchy, blistery skin rash, that is dermatitis herpetiformis. Also, mouth ulcers can take place. You may also suffer from headaches and fatigues. There could be nervous system injury, including numbness and tingling in the feet and hands. Possible problems with balance and cognitive impairment can also occur. Also, you may suffer from joint pain, and there could be reduced functioning of the spleen, which is known as hyposplenism. These additional symptoms are due to malabsorption of important nutrients, and the digestive system, which I have told you, are due to damage to the small intestine villi. Okay, and since most of the symptoms of the celiac disease resemble irritable bowel syndrome, that's why I'm making this video, because earlier I posted a video about irritable bowel syndrome. So in irritable bowel syndrome, the symptoms of that syndrome are almost similar, like celiac disease. So I recommend everyone to please watch that irritable bowel syndrome video also, because that is also very, very important. And also, by watching that video, you will come to know the differences between these. Not only differences, but you will also come to know similarities between celiac disease and irritable bowel syndrome. Okay. So I strongly recommend to watch that irritable bowel syndrome video as well. Now, coming to the symptoms in children. Children with celiac disease are more likely than adults to have digestive system that include nausea and vomiting, chronic diarrhea, swollen belly, constipation, gas, and there may be pale and foul-smelling stools. Okay. Also, due to inability to absorb nutrients, this might result in failure to thrive for infants, damage to tooth enamel, weight loss, anemia, irritability, short stature. There could be also delay in achieving puberty. Also, some children suffer from neurological symptoms, including attention deficit hyperactivity disorder, which is ADHD in short form. There could be some learning disabilities, headaches, a lack of muscle coordination, and seizures. Okay. Then there is a skin condition known as dermatitis herpetiformis, and that can also occur. Gluten intolerance can cause this itchy blistering skin disease. The rash usually occurs on the elbows, knees, torso, scalp, and buttocks. This condition is often associated with changes to the lining of the small intestine, identical to those of celiac disease. But the skin condition might not cause digestive system. I mean, this skin condition can be independent also. Okay. Doctor treat dermatitis herpetiformis with a gluten-free diet or medication or both to control the rash. Consult your doctor if you have diarrhea or digestive discomfort that lasts for more than 2 weeks. Consult your child doctor if your child is pale, irritable, or failing to grow, or has a pot belly and foul swelling, bulky stools. Be sure to consult your doctor before trying a gluten-free diet. So this is a very important point. Because if you stop or even reduce the amount of gluten you eat before you have tested for celiac disease, you can change the test results. So it's important to consult a doctor like me, and if you think that you are developing the symptom of celiac disease or if you have a family history. Okay. Celiac disease tends to run in families. If someone in your family has the condition, ask your doctor if you should be tested. Also ask your doctor about testing if you or someone in your family has a risk factor for celiac disease such as type 1 diabetes. Okay. So this is a risk factor, and a more risk factor I will discuss shortly. Okay. Now let me tell you the causes of celiac disease. Your genes combined with eating food with gluten and other factors can contribute to celiac disease, but the precise cause is not known. Infant feeding practices, gastrointestinal infection, and gut bacteria might contribute as well. Sometimes celiac disease becomes active after surgery, pregnancy, childbirth, viral infection, or severe emotional stress. When the body's immune system overreacts to gluten in food, the reaction damages the tiny hair-like projection, which are known as villi, that line the small intestine. Villi absorb vitamins, minerals, and other nutrients from the food you eat. If your villi are damaged, you cannot get enough nutrients no matter how much you eat. Now let me tell you the risk factors. Celiac disease tends to be more common in people who have a family member with celiac disease or dermatitis herpetiformis, type 1 diabetes, Down syndrome or Turner syndrome, autoimmune thyroid disease, and microscopic colitis, which is also known as lymphocytic or collagenous colitis, or Addison disease. I mean, there are certain autoimmune disorders. If you are having those disorders, then these are the risk factors for celiac disease. Okay. Now let me tell you the complications. If the celiac disease is untreated, it can cause malnutrition. This occurs if your small intestine cannot absorb enough nutrients. Malnutrition can lead to anemia and weight loss. In children, malnutrition can cause slow growth and short stature. Bone weakening. Malabsorption of calcium and vitamin D can lead to softening of the bone, which is known as osteomalacia, and also rickets can also occur in children, and a loss of bone density, which is called as osteopenia or osteoporosis in adults. Okay. Infertility and miscarriage. Malabsorption of calcium and vitamin D can contribute to reproductive issues. Lactose intolerance. Damage to your small intestine might cause you abdominal pain and diarrhea after eating or drinking dairy products that contain lactose. Once your intestine has healed, you might be able to tolerate dairy products again. Cancer. People with celiac disease who do not maintain a gluten-free diet have a greater risk of developing several forms of cancer, including intestinal lymphoma and small bowel cancer. Nervous system problems. Some people with celiac disease can develop problems such as seizures or a disease of the nerves to the hands and feet, which is known as peripheral neuropathy. Then there is another form of celiac disease which is known as non-responsive celiac disease. Some people with celiac disease do not respond to what they consider to be a gluten-free diet. Non-responsive celiac disease is often due to contamination of the diet with gluten. Working with a dietitian can help you learn how to avoid all gluten. People with non-responsive celiac disease might have bacteria in the small intestine, that is bacterial overgrowth, microscopic colitis, poor pancreas function, that is pancreatic insufficiency, irritable bowel syndrome, and difficulty digesting sugar food, sugar found in dairy products, that is lactose, table sugar, that is sucrose, or a type of sugar found in honey and fruits, that is known as fructose. Also it can lead to refractory celiac disease. Okay. So let me tell you something about refractory celiac disease. In rare instances, the intestinal injury of celiac disease does not respond to strict gluten-free diet. This is known as refractory celiac disease. If you still have signs and symptoms after following a gluten-free diet for 6 months to 1 year, you might need further testing to look for other explanations for your symptoms. Okay. Now let me tell you the diagnosis of celiac disease. Many people, when they come to us with celiac disease, they do not know they have it. 2 blood tests can help diagnose it. The first is serologic testing, in which we look for antibodies in your blood. Elevated levels of certain antibody proteins indicate an immune reaction to gluten. Also, we can order genetic testing for human leukocyte antigen HLA-DQ2 and HLA-DQ8 that can be used to rule out celiac disease. Okay, it is important to be tested for celiac disease before trying a gluten-free diet. Eliminating gluten from your diet might make the results of blood tests appear normal. If the results of these tests indicate celiac disease, your doctor will likely order other tests. For example, a doctor may order endoscopy. This test uses a long tube with a tiny camera that is put into your mouth and passed down your throat. That is known as upper endoscopy. The camera enables your doctor to view your small intestine and take a small tissue sample, biopsy, to analyze for damage to the villi. Another test also we can order, that is a capsule endoscopy. This test uses a tiny wireless camera to take pictures of your entire small intestine. The camera sits inside the vitamin-sized capsule which you swallow. As the capsule travels through your digestive tract, the camera takes thousands of pictures that are transmitted to a recorder. If your doctor suspects you have dermatitis herpetiformis, he or she might take a small sample of skin tissue to examine under a microscope, that is known as skin biopsy. Okay. Now coming to the treatment, a strict lifelong gluten-free diet is the only way to manage celiac disease. Besides wheat, food that contain gluten include. Now I am going to tell you the food which contain gluten. These are barley, bulgur, durum, farina, graham flour, malt, rye, semolina, spelt, which is a form of wheat, and triticale. Okay. A dietitian who works with people with celiac disease can help you plan a healthy gluten-free diet. Even trace amounts of gluten in your diet can be damaging even if they do not cause signs or symptoms. Gluten can be hidden in foods, medication, and non-food products that include modified food starch, preservatives, and food stabilizer, prescription and over-the-counter medication, vitamin and mineral supplements, herbal and nutritional supplements, lipstick products, toothpaste and mouthwash, communion wafers, and whelp and stamp glue played off. Okay, removing gluten from your diet will gradually reduce inflammation in your small intestine, causing you to feel better and eventually heal. Children tend to heal more quickly than adults. Also, if we may prescribe vitamin and mineral supplements for you. If your anemia or nutritional deficiencies are severe, your doctor or dietitian might recommend that you take supplements including copper, folate, iron, vitamin B12, vitamin D, vitamin K, and zinc. Vitamin supplements are usually taken in pill form. If your digestive tract has trouble absorbing vitamins, your doctor might give them by injection. Also, follow-up care is very necessary. Medical follow-up at regular intervals can ensure that your symptoms have responded to a gluten-free diet. Your doctor will monitor your response with blood tests. For most people with celiac disease, a gluten-free diet will allow the small intestine to heal. For children, that usually takes 3 to 6 months. For adults, complete healing might take several years. If you continue to have symptoms or if symptoms recur, you might need an endoscopy with biopsy to determine whether your intestine has healed. Okay. Also, we may prescribe medication to control intestinal inflammation. If your small intestine is severely damaged or you have refractory celiac disease, your doctor might recommend steroids to control inflammation. Steroids can ease severe signs and symptoms of celiac disease while the intestine heals. Other drugs such as azathioprine, which comes with the name of azasan or imuran, or budesonide, which comes with the name of Entocort EC Euceris, might be used. Okay. Also, we need to treat dermatitis herpetiformis. If you have this skin rash, your doctor might recommend a medication such as Dapsone, which is taken by mouth, as well as a gluten-free diet. If you take Dapsone, you will need regular blood tests to check for side effects. Also, if you have refractory celiac disease, your small intestine won't heal, then you will likely need to be evaluated in a specialized center. Refractory celiac disease can be quite serious and there is currently no proven treatment. Now I should tell you the lifestyle and home remedies. If you have been diagnosed with celiac disease, you will need to avoid all foods that contain gluten. Ask your doctor for a referral to a dietitian who can help you plan a healthy gluten-free diet. You should read labels. Avoid packaged food unless they are labeled as gluten-free or have no gluten-containing ingredients, including emulsifiers and stabilizers that can contain gluten. In addition to cereals, pastas, and baked goods, other packaged foods that contain gluten include. Now I am going to tell you the foods which contain gluten you should avoid unless it is mentioned on their label that they are gluten-free. Okay. So these foods include beers, lagers, ales and malt vinegars, candies, gravies, imitation meats or seafood, processed luncheon meats, rice mixes, salad dressing and sauces including soy sauce, seasoned snack foods such as tortilla and potato chips, seitan, self-basting poultry, soups. So these are the foods which you should be very careful because they contain gluten unless they are labeled as gluten-free. Okay. Pure oats are not harmful for most people with celiac disease, but oats can be contaminated by wheat during growing and processing. Ask your doctor if you can try eating small amounts of pure oat products. Okay. Now I will tell you the foods which are allowed. Okay. Many basic foods are allowed in a gluten-free diet that include eggs, fresh meats, fish and poultry that are not breaded, batter cooked or marinated. Also you can take fruits, lentils also you can take. Most dairy products unless they make your symptoms worse. Nuts, potatoes, vegetables, wine and distilled liquors, ciders and spirit. Grains and starches allowed in a gluten-free diet include amarnath, buckwheat, cornmeal, gluten-free flours which are rice, soy, corn, potato, bean, pure corn tortillas, quinoa, rice, tapioca and wild rice. So these are the foods which are allowed foods in allowed food category which you can take, and be sure that there is absolutely no gluten in any food. Okay, because that is the ultimate treatment. Okay. So this was my video about celiac disease. I hope you have found this video very useful. Okay. Till now, if you haven't subscribed my channel, please subscribe this channel and click the bell icon so that all upcoming videos are delivered to your inbox straight away. Okay. And if you think that my videos provide some sort of benefit, even it is a little bit benefit, please do not forget to give a thumbs up to this video.